Hi again, I'm Ed Long, founder and CEO of Independence Anesthesia. Good to see everyone again, and thanks for tuning in. In this week's video, we have more news on a vaccine for COVID-19, states reopening, and 2 CRNAs experiences working on the front line. In addition, we'll also have new jobs we're looking to fill. Here's some good news. Steroids.
Do you even lift, bro?
Medical steroids. Dexamethasone, which is a cheap and widely used steroid, has been hailed as a major breakthrough for treating COVID-19. It has become the first drug shown to be able to save lives among COVID-19 patients. The results of the trial for dexamethasone have shown to have reduced death rates by around a third among even the most severely ill patients. The researchers who led the trial believe that these results suggest that the drug should immediately become a standard of care in patients. Peter Horby, co-leader of the trial, said dexamethasone is the only drug that's so far shown to reduce mortality and that it's inexpensive, on the shelf, and can be used immediately to save lives worldwide. While the results in Oxford have been positive, the findings are not yet peer-reviewed. Doctors have said they need to see the entire study to really know the impact of this steroid. As we covered in a previous news segment, after much hype, hydroxychloroquine not only does nothing for COVID, but the researchers stated the risks outweigh the benefits and it actually may increase mortality. Experts had previously warned individuals not to take the drug outside of a hospital's strict supervision back in April. This new move by the FDA officially revoked its approval of emergency use of hydroxychloroquine for COVID treatment at all. There's some good news coming out of New York. Deaths in New York City dropped from 1,000 a day back in April to only 40 a day in the last 2 days. After spending weeks around 300 deaths a day, New Jersey has dropped similarly down to about 50 a day in the last few days. That's an astounding rebound. In fact, 20 states are decreasing and 12 states and territories are staying basically the same on new COVID numbers. However, as states have been reopening for the past few weeks now, there have been worries about whether or not this would result in more COVID-19 cases. This has seemed to be the case as hospitalizations have been rising in Arizona, Texas, and nearly the entire Southeast. These increases seem to be largely in suburban and rural counties, as it is in the state of Georgia. Atlanta, Augusta, and Athens are all flat or trending down, while more rural areas are going up. Hopefully, people will heed the warnings of Dr. Fauci and others to keep up the social distancing and mask wearing so we can bring this new spike back down. And now some news on CRNAs. We have stories on 2 CRNAs that have been working hard on the front line to fight the coronavirus. After Catherine Dean of Williamsburg was furloughed from her job in March, she applied to work a position in New York City. She then signed up for a month-long contract to work at Mount Sinai Hospital with hundreds of other nurses. Dean said it was very chaotic when she first arrived. She averaged about 60 hours a week and worked exclusively with COVID-19 patients. Another CRNA in the spotlight is Corey Ann Kleinhaus. At the beginning of the pandemic, Corey Ann was furloughed for a week and personally experienced the stress of this pandemic in and out of the hospital. Along with working on the COVID-19 front line, Corey Ann and her husband launched an emotional and well-being app called All Well. We are happy that she is trying to help people both with the virus and with their own well-being. And now, the jobs. In Western New York, we have a CRNA position for $140 an hour. Cases are colonoscopy, upper GI, endoscopy, no OB, no ortho, and no peds. The next job is located in a charming southeastern Ohio town at $148 an hour. Cases are bread and butter, some OB, and also will assist in the pain management clinic. Coming from the same state, we have a job up in northwestern Ohio for $155 an hour. Cases are general, bread and butter, everything except hearts and OB. In northern Kentucky, there's an ongoing need for a CRNA. It is at $125 an hour with mostly general cases, and there is no OB, regionals, or big cases, unless you just want them. As always, we want to hear from you. If you've got something to share with the community, please reach out to us. Please share news and stories and tune in again next week. We're all in this together.